siblings, I'm the least smart among us all. I remember my mom got sick with malaria. I was praying the rosary and I said, you know, Jesus, if you will spare my mom's life, I will work as a nurse for the rest of my life. But not knowing destiny will bring me in New York.
So we gravitated towards New York.
I remember all 8 of us went to New York City, right? Of course, it's exciting, but it's kind of scary too.
You held hands going to New York City. You were always together. You never were by yourself.
Turning right, turning left, and there's so much to see. I felt the energy and it's great. It's amazing.
You have the operas, you have Broadways. If you are here, you can spread your wings.
Some of my classmates, they went to really good hospitals all over the country. You could go anywhere at that time. You know, the opportunity is there to come and experience American nursing. And also, we're helping our families back home. I was helping my siblings go to college. Because if you worked as a nurse in the Philippines, you can't even support yourself, never mind supporting others. We didn't have the same opportunity in the Philippines.
This is incredible to have Filipino American History Month be celebrated in this space and to have our film be shared with all of you. I am the lone filmmaker on this panel, but I do view my work as cultural work. It's very important. What I do is represent and reflect the stories of our culture and our community. So I'm very proud to be the director of Nurse Unseen because this is a story of our community, of our titos and our titas, and it deserves to be shared on the big screen. So I made Nurse Unseen because I wanted to pay tribute to my tita Dodo, who was a pediatric oncology nurse here in Washington, D.C. at Children's Hospital. She passed away several years ago, and I always wanted to get to know her more because she never really shared that much with me. She never really shared about the hardships of her work. She never shared about why she came to the US and how hard that must have been. And I never really was curious, in fairness. So she passed, unfortunately, but I wanted to get close to her and to honor the many titas like her, who are essentially the backbone of our healthcare system. So I made Nurse Unseen in part to pay tribute to them, but also to shine a light on the modern history, what we're going through in COVID. So in late 2020, the National Nurses United organization came out with a study that really outlined just how vulnerable our community was to the virus. So they reported that although Filipino nurses make up only 4% of the registered nurses in this country, at the height of COVID, they made up over 31.5% of our COVID nurse deaths. So that was a tragic, very devastating statistic, and I knew then that I needed to move into action and create a film that would both celebrate and honor my titas and titas like her, but also amplify what was happening to our community at the time of COVID. So I represent the importance of storytelling and representation in regards to all the key issues that we will be discussing here today. So thank you.
I cannot begin to tell my story without first paying homage to the ancestors who have spent time on this earth to allow us to be where we are today. I think of my immigrant parents and my partner Matthew, who are watching the kids now so I can be here. I am a tenured professor of counselor education at Cleveland State University. I am a Forbes Health Advisor and racial equity strategist. So my work centers on the importance of decolonizing, promoting, and destigmatizing mental health among marginalized communities, including FilAms. So quick little show of hands here. How many of you remember 2020? The trauma. Skype dropped the ball. No one wore real pants. And rates of anti-Asian discrimination skyrocketed. As a mental health professional, I look to the research to see what is being published on evidence-based modalities to support disaffiliated Asian communities. And I was shocked to find no one had done the work. There was nothing on any of the most popular common websites or academic listservs that focused on mental health support within communities. So I thought, okay, there's something here that needs to be done. On March 2021, the headline that hit me the most was the one about the Asian American, the Filipino woman, the 65-year-old woman who was attacked in New York while others watched. In March of 2021, my own mother was 64, and that could have been her. That was enough for me to roll up my sleeves, and we got to work. I published over 30 peer-reviewed publications from 2020 to 2022, resulting in over 50 academic publications across the past 5 years. 17 of them are archived in the World Health Organization's database on COVID-19 literature. So my focus is really centering the importance of mental health and destigmatizing that so we're able to have more equitable services for our communities.